Anyone 18 years old or older can now get a coronavirus booster shot in the United States. The CDC widened the pool of eligibility Friday. It now recommends adults get a third shot 6 months after their last dose of a Pfizer or Moderna vaccine. People who got Johnson & Johnson's single-dose vaccine should get their booster 2 months after their first dose. Right now, new COVID-19 cases are spiking in several states, mostly among unvaccinated people. Health officials hope that the new booster shot guidance will help prevent a larger winter surge of infections. CBS News' Elise Preston has more.
The unvaccinated have swelled Minnesota ICU beds to capacity. More than 3,000 COVID patients are hospitalized in Michigan, a number not seen since the spring. They are among 4 upper Midwest states with the highest rates of new COVID cases.
The message has to be loud and clear. You can't run out the game clock on this one. This virus will find you.
As travelers start heading home for Thanksgiving, health officials hope booster shots will help those already vaccinated avoid getting sick.
If you're one of the approximately 100 million people in this country already eligible for a booster, our recommendation is that you get the extra protection afforded by a booster as soon as possible.
3 out of every 10 Americans remain unvaccinated. Philadelphia yesterday became the latest big city to mandate vaccinations for its 26,000 employees, joining a dozen others, including Los Angeles and Chicago. Other cities are tempering mandates by allowing regular testing for unvaccinated workers instead, and some places are going to court. Watching the backlash is Professor Allison Hoffman, who writes about healthcare law and policy at the University of Pennsylvania.
And going back 116 years to 1905, a case called Jacobson versus Massachusetts, the court said that that in cases where there is a public health need, that states and localities can put public health measures into place. And so things like vaccination mandates and other public health measures have a long history.
For more on this, I want to bring in Justin Lowenthal. He is the Director of Partnerships and External Strategy for Doctors for America. He's also an MD and PhD candidate at Johns Hopkins University School of Medicine. Justin, now that the CDC has given the okay for all adults to get booster shots, do you expect a high demand?
Yeah, I think we're already seeing questions from patients coming into the hospital and coming into clinics about if and when they should get their boosters. I think this move by the FDA and the CDC is a good one to clarify that eligibility, because there has been a lot of confusion. And I think now that it's clarified that anyone 18 or older is eligible and anyone over 50 is strongly urged to get this booster shot, I think people will feel a lot more comfortable knowing that they can and should and will make plans to do so.
Help our viewers understand, how much more protection does a booster shot provide for someone who's already vaccinated?
Yeah, it's a really good question and one we're getting a lot. We've been studying these vaccines ever since they were first created, and we've been studying them ever since they were first deployed. And I think what we're finding is that even though you maintain protection from these vaccines for months and months and months after you get them, the antibody levels in our bloodstreams actually decline over time. And this is a natural process that our immune system goes through to detect different types of threats. And so the lower those antibody levels become, the more possible it is for us to get infected with the vaccine. Now, that doesn't necessarily mean that we'll get very sick or hospitalized. The vaccines, even the first 2 doses of Pfizer and Moderna, are still very, very strong protection against sickness and hospitalization. But it makes it a little bit easier to get infected. And if you get infected, it makes it easier for you to spread it to friends and family and community members who are vulnerable. And so what we're telling people is that if you're vaccinated at all, that's a very good thing. And that gives you the protection that you need against getting sick and ending up in the hospital. But the booster is really a good step to take to enhance your protection, to prevent you from even catching COVID in the first place. And if you catch it, making your illness basically asymptomatic, or even if you get sick, shortening that time and making it less severe. And that protects all of us. And I think that's what we're telling our patients.
Your organization, Doctors for America, part of the slogan is putting patients over politics. How difficult has it been to try and talk about vaccines, booster shots, et cetera, given that it seems like the debate over it has become so politicized in America?
I think it has been really, really challenging. And part of the reason isn't so much even the politicization of it, but it's just the rampant misinformation that has spread through media outlets as well as online. One of the initiatives we have helped spearhead is a letter to Facebook executives asking that they release their data on misinformation spread online. And what we see as doctors and as medical students are patients who come in with a lot of preconceived notions and misconceptions about what the vaccines do, what protection they can get if they're vaccinated, what protection they may get if they've already had COVID. And it just makes the work of getting people their first vaccine that much harder. But we still see that doctors, medical students, and family members and close trusted friends are the best messengers to get the word out about the right information about vaccines, and that the best protection for all of us is to get those who don't have a vaccine their first shot. And especially if you're vulnerable, getting a booster shot. As well, this season is getting your flu shot, because one of the things we're worried about are the two pandemics of a flu and COVID colliding this winter.
So what is the position of Doctors for America when it comes to Thanksgiving and people getting together, especially in groups that have some family members or friends that are vaccinated, some that are partially vaccinated, some that are unvaccinated?
I think we, along with all of our colleagues around medicine and public health, want people to be safe, but also understand that Thanksgiving is a time for all of us to get together, and we've sorely missed it the last few years. And so it's really important for all of our collective societal mental health to be able to celebrate together. And so we want people to be safe. That means if everyone in your family is fully vaccinated, hooray, we're thrilled that you'll be able to celebrate safely together. If you're fully vaccinated and somebody around you is at high risk, I think celebrating together is a wonderful idea. But just maybe traveling to that person who's higher risk and making sure they can get their booster and their flu shot as well. If your kids are not yet vaccinated, but all of the adults are, just by virtue of all of the adults being vaccinated, it does provide some community protection around the children. And if not all adults are fully vaccinated, I think what we're telling people is it may be some difficult conversations that you have to have about who should gather together in person. But if everyone does, it's still the standard public health protections, the common sense protections around hand washing, around good ventilation, around using masks when you can. And if the weather's nice, even moving some of the celebrations outdoors, just to reduce everyone's risk.
Probably advice that'll work better for our southern viewers than those of us up north.
Absolutely.
All right, Justin Lowenthal, thank you.
Thank you.